everyone, welcome to TryWrite. This is Pack 365, myself Srija. So today in this session, you're going to learn about the continuation of ICD-10-CM coding classification for the diseases of ear and mastoid process. So coming to code category of H8 to H83. So what does this category include? Diseases of cochlea, vestibular system, and inner ear structures responsible for the hearing and balance. So what is H80? Otosclerosis. So what is otosclerosis? It is an abnormal bone remodeling disorder of the otic capsule, especially around the stapes footplate, leading to progressive conducting hear loss, sometimes mixed or sensorineural loss if the cochlear movement occurs. So what is the pathophysiology? Normally, the stapes moves freely in the oval window to transmit the sound vibrations. So in otosclerosis, a spongy bone replaces the normal dense bone, causing the fixation of the staple reduced mobility. It reduces the sound conduction, also possible invasion into the cochlea. So what is the subcode over here? H80.0. It is for otosclerosis involving the oval window. So this is the classic form where the bony overgrowth fixes the stapes footplate at the oval window. So what is the example over here? It's a young female with slowly progressive hearing loss. So it is a normal tympanic membrane on the otoscopy. So why young females? Because hormonal changes takes place within the young females like pregnancy, estrogen. This can accelerate the otosclerotic activity. So whenever otosclerosis involving the oval window is diagnosed, you have to assign the code H80.0. So next subcode is H80.1, cochlear otosclerosis. So the bone remodeling affects the cochlear capsule. What is the primary symptom? The sensory neural hearing loss, which is not the conductive. So here there is a picture showing you the stapes, incus and malleus anatomy. So this diagram shows the normal ossicular chain, the areas of bony overgrowth in the otosclerosis. At stapes footplate it is most common, and you can also see the junction of incus and stapes. So this explains why the stapes become immobile, which leads to the conductive deafness. So next category code is H81. So this describes about the disorders of vestibular function. So these disorders, they affect the balance organs. Like semicircular canals, they detect the rotation, whereas vestibular nerves like utricle and saccule, they detect the linear movement. So H81.0 is Meniere's disease. So what is Meniere's disease? It's a chronic disorder causing by endolymphatic hydrops, which is an excessive fluid in the inner ear. So what is an example? Recurrent vertigo, attacks with the fluctuating sensorineural hearing loss. So this is a 20 minutes, it takes time from 20 minutes to hours, usually at a low frequency from the early on. And then tinnitus or ear fullness. So what is the example? You can see the repeated vertigo attacks. So whenever Meniere's disease is diagnosed, you have to assign the code H81.0. So next is H81.2. It is benign paroxysmal positional vertigo, which is also called as BPPV in a short form. So what is BPPV? It's a vestibular disorder which is caused by a otoconia. So which are the calcium crystals. So that dislodge from the utricle and also they enter the posterior semicircular canal. So what is the pathophysiology? The movement of the dislodged crystals that stimulates the canal abnormally, so which leads to the brief episodes of the vertigo triggered by the head position changes. So what are the symptoms of BPPV? Vertigo when turning in the bed, positive Dick's Hallpike test, and also no hearing loss or tinnitus. So here you can see the BPPV picture. In this, there is an otoconia falling into the posterior semicircular canal. So how the head movements causes the displaced crystals to trigger the vertigo. So this shows before and after movement of the particles. So here this is a displaced otoconia. So next is H81.4, vertigo of central origin. So what does it mean? The vertigo caused by the brain lesions, which is a central nervous system, but not the inner ear issues. So what are the examples like stroke in the cerebellum or the brainstem, multiple sclerosis, plaques, and also the tumors. So what are the typical features? You can see the persistent vertigo, severe gait instability, and also the direction changing, nystagmus, and also the neurological signs. So next category is H82, which is a vertiginous syndromes in disease classified elsewhere. So why this category means H82 is used when vertigo, it is not due to a primary ear disease, but it occurs secondarily due to the another systemic or neurological condition. So these disorders, these are coded in the addition to the primary disease. So what are the causes of the vertigo classified elsewhere? The first cause is syphilis. It is a late neurosyphilis which affects the vestibular nerve or cochlea. So this causes the dizziness, imbalance, and also the hearing loss. So next cause is multiple sclerosis, which is a vestibular symptom. So MS plaques in the brainstem or cerebellum, they can lead to the vertigo, nystagmus, gait disturbances, etc. And the third cause is viral infection. So viruses, they can affect the vestibular nerve or the inner ear, leading to the vertigo. For example, herpes zoster oticus, which is the Ramsay-Hunt syndrome. So this involves the influenza and also the varicella. So what is the example given in a slide over here? Vertigo caused by the herpes zoster oticus. So this is classified under H82 because the primary cause is a vertical or viral infection, which is a herpes zoster, and the vertigo is a secondary manifestation. So H82 is nothing but the vertigo caused by a disease outside the ear. So if the ear itself is the primary source, you have to assign the code H81 or H83. So if vertigo is due to another disease, you have to assign H82. So this is how you have to assign the code H82. So next category code is H83, which is a other inner ear disorders. So H83, it includes the diverse disorders that originate directly in the inner ear, affecting the cochlea, vestibule, semicircular canals, and also the combined sensory structures. So what is the subcode? H83.0 for labyrinthitis. So whenever labyrinthitis is diagnosed, you have to assign the code H83.0. So what do you mean by labyrinthitis? It's an inflammatory disorder of the inner ear part labyrinth, which is involving both the cochlea for hearing and vestibular system for balance. So this differentiates the labyrinthitis from the vestibular neuritis, which is for vestibular symptoms only, but there is no hearing loss in this vestibular neuritis. So what are the causes of the labyrinthitis? You can see the viral infections, bacterial infections, and also from the autoimmune inner ear disease. So what will be the symptoms? You can experience the vertigo, which is acute or severe, hearing loss, which is sensory neural hearing loss, tinnitus, and nausea or vomiting, and also the imbalance. So example given in the slide is vertigo with hearing loss after a viral infection. So in the right side, you can see the picture labyrinthitis. So this diagram shows you the inflamed inner ear structure. So the semicircular canals, which are responsible for the rotational balance, cochlea, which is responsible for hearing, and vestibular nerve fibers inflamed. These are responsible for the eardrum and eustachian tube context for the orientation. So this helps you to visualize that labyrinthitis affects both the hearing and balance pathways. So this is about the code H83.0, which is assigned for labyrinthitis. So next subcode is H83.1 for labyrinthine fistula, which is an abnormal opening between the middle ear and the inner ear labyrinth. So H83.2 is for labyrinthine dysfunction. So this is a broader category for the conditions causing the abnormal function of the labyrinth without a specific pathology. So this includes the toxic damage, the age-related degeneration, barotrauma, and the trauma-induced vertebral dysfunction. So next code is H83.9, the inner ear disorder unspecified. So this is used when a patient clearly has an inner ear problem, but the exact diagnosis is unknown or the insufficient documentation is available. For example, acute vertigo plus hearing loss, but there is not enough findings to classify. There is an undiagnosed inner ear inflammation. So in these cases, you have to assign the code H83.9. So next category code is H90 for conductive and sensory neural hearing loss. So ICD-10 category H90, it is used for the hearing loss caused by dysfunction of the external ear, middle ear and also the inner ear or combination of these structures. So this include the conductive, sensory neural and mixed hearing loss patterns. So H90.0 code is assigned for conductive hearing loss which is a bilateral. So what does it mean? A conducting hearing loss, it occurs when the sound waves cannot efficiently travel through the external ear canal, tympanic membrane and the middle ear ossicles. So since it is bilateral, both the ears have the reduced sound condition. So what will be the causes of the conducting hearing loss? Otosclerosis, chronic otitis media, middle ear effusion, eardrum perforation and also the ossicular chain discontinuity. So what is the example? Bilateral otosclerosis causing the progressive hearing loss. So this is classic because otosclerosis often affects both the stapes, foot plates. So next subcode is H90.1. So this is about the conducting hearing loss which is unilateral with restricted hearing on the contralateral side. So what does this mean? One ear has the significant conductive loss while the other ear has the some degree of the reduced hearing but not necessarily conductive. So what is the example? Otitis media in one ear plus mild age related hearing loss in the opposite ear. So this fits because the otitis media is a unilateral one whereas presbycusis is a mild HN, HL in the other ear. So this is how you have to code the H90.1 code. So next is H90.6 for mixed conductive and sensory neural hearing loss bilateral. This means both ears have two coexisting problems. So one is conductive component and the other is sensory neural component. This means the middle ear pathology plus also the inner ear pathology both are present in this condition. So what will be the causes? Chronic otitis media with the cochlear damage and also advanced otitis media complications. So example is a patient with long-standing chronic ear infection, progressive inner ear damage due to toxins or inflammation. So next is H90.9 which is assigned for hearing loss and unspecified. So this is used when hearing loss is documented but the type, whether it is a conductive, whether it is a sensory neural or mixed is not known or it is not evaluated. So insufficient documentation is provided in the medical record. So what is the example? If a patient writes hearing difficulty for years, but there is no audiometry or clinical evaluation is available. So then you have to assign this code H90.9. So next category code is H91 which is for other hearing loss. So this ICD-10 category, it includes hearing loss but not due to the conductive causes and these are not classified under H90 category. So it mainly includes sensory neural hearing loss due to medications, aging or unnuclear causes. So how does it classify H91.0 for ototoxic hearing loss? So what does it mean? Sensory neural hearing loss caused by the medications or chemicals that damage the hair cells in the cochlea or the auditory nerve. So what is the mechanism of the ototoxic hearing loss? Ototoxic drugs, they damage the outer hair cells first, then high frequency hearing loss first. So with the continued exposure, the inner hair cells and the vestibular hair cells, they may be affected. So this can create the damage may be permanent because the hair cells do not regenerate. So what are the examples of the ototoxic drugs? Aminoglycosides like gentamicin, amikacin, so which causes the cochlear toxicity or vestibular toxicity. Next is cisplatin. So cisplatin, it is a chemotherapy drug. So this causes bilateral high frequency SNHL. And the third drug is loop diuretics. So it may be a furosemide and bumetanide. So these are reversible or irreversible depending upon the dose and kidney function. So what is the example given here? A chemotherapy patient developing the bilateral sensorineural hearing loss. So this is a classic presentation of the cisplatin ototoxicity. So the right side you can see the image showing you presbycusis. So it shows you the bilateral movement, which is the most ototoxic. Hearing loss is asymmetric, and then this is an audiogram, a graph which you can see here. This audiogram, it shows high frequency drop and then cochlea where hair cell degeneration takes place, and then noise exposure plus age, which both accelerate the SNHL, and then the hearing aid, which is used when hearing loss becomes functionally significant. So next is presbycusis. You have to assign the code H91.1 for presbycusis. So this is an age-related sensorineural hearing loss, progressive and bilateral. So what is the cause of presbycusis? The degeneration of the cochlear hair cells, degeneration of the basilar membrane, and also the auditory nerve fibers. So what are the key features? You can see slowly the gradual progression and difficulty hearing high frequency sounds first, and you can also see the trouble hearing speech in noisy environments and usually symmetric loss. So for example, a 70-year-old with difficulty hearing high frequency sounds. So this is the hallmark of the presbycusis. So next category code is H92, which describes the otalgia and otorrhea. So these codes cover the ear pain and also the ear discharge. This which originate from the ear or be referred from nearby structures. So H92.0 for otalgia, which is the ear pain. So the pain arises from the ear itself and also referred from the dental issues, temporomandibular joint, throat infections, and also cervical spine problems. So there are types of otalgia. There's a primary otalgia and also the referred otalgia. So ear pain, it does not always mean an ear disease, especially in the adults, where referred pain is very common. So this is about the ear pain. So the next slide, it is otorrhea, which you have to assign the code H92.1 for otorrhea. Otorrhea is nothing but it's a ear discharge, like fluid, pus or mucus leaking from the ear. So what is the example? Otis externa with the pus. So the infection of the external auditory canal, which produces a thick yellow or green discharge. Tympanic membrane perforation with the drainage. Nothing but it's a hole in the eardrum which allows the middle ear fluid to drain outward. So here is a picture which shows you the otorrhea. Though the picture shows an external ear canal with visible pus-like fluid. So this is a classic appearance of the otorrhea due to infection. So next is H92.2 code for otorrhagia. So what is meant by otorrhagia? It is a bleeding from the ear. So what will be the common causes for bleeding? Trauma to the ear canal, temporal bone fracture, and infections causing the irritation and bleeding. So what is the example? Trauma to the ear canal leading to the visible blood. So you have to assign code H92.2 for otorrhagia. So next is H93 code for other disorders of the ear. So this section includes the disorders which are not due to infection or hearing loss. So but due to vascular, neurological or abnormal auditory sensations. So the subcode is H93.0 for degenerative and vascular disorders of the ear. So these conditions, they reduces the blood supply to the inner ear or damage cochlear structures. So what is the example? Cochlear ischemia. So which leads to reduced oxygen supply and also the sudden or progressive sensorineural hearing symptoms. And next is inner ear vascular insufficiency. So this may cause vertigo, tinnitus or hearing fluctuations. So next is H93.1, which is tinnitus. So what do you mean by tinnitus? Ringing, buzzing, humming or whistling sound perceived in the ears without the external stimulus. So here you can see a label diagram of tinnitus at the right side. This shows the ear canal, middle ear and inner ear. So it's a box highlighting the inner ear cochlea where the tinnitus often originates. So icon showing the common causes of the tinnitus. So what are the common causes of the tinnitus? Damage to the cochlear hair cells, trauma or injury, earwax blockage, and the ear infections. So these factors, they irritate the auditory pathways through which the brain interprets the disrupted signals as a sound, nothing but ringing. Okay, so whenever tinnitus is assigned or tinnitus is diagnosed within the patient record, you have to assign the code H93.1. So next code is H93.2, which is for other abnormal auditory perceptions. So next subcode is H93.3, disorders of the auditory nerve. So this code, it is used when the auditory nerve, which is the 8th cranial nerve, is affected, which leads to abnormal sound transmission from the inner ear to the brain. So what are the examples? Auditory neuropathy and the nerve degeneration. So auditory neuropathy, it is a condition where the outer hair cells of the cochlea may function normally, but the signal is transmitted properly by the auditory nerve. So patients often have the difficulty understanding speech, normal otoacoustic emissions, and also abnormal ABR. So what do you mean by nerve degeneration? It can occur due to aging, toxins, tumors, chronic noise exposure, and also the systemic diseases. So this nerve degeneration, it can lead to poor clarity of the hearing. So it also leads to delayed or distorted sound processing. So this is about the category code H93. So next is H94 code category, which involves the other disorders of the ear in diseases classified elsewhere. So this category, it is used when ear problems develop as a secondary effect of another disease outside the ear, like secondary ear disorders, not primary ear disease but caused by another systemic or infectious condition. So what is the use of 94? So you have to code H94 only when there is a confirmed underlying condition outside the ear and the ear symptoms are a complication of that condition. So examples from the slide is hearing loss due to meningitis. So meningitis, they can cause a damage to the cochlea or auditory nerve. So this causes sudden or permanent sensory neural hearing loss. So here the primary code is meningitis because it's the underlying disease, and H94 is added as a secondary code for the ear related complication. So in this way you have to code H94. So the other examples are ear nerve damage due to diabetes and otologic complications of the autoimmune disease. So next is, what are the subcodes of H94? So H94.1, it includes the autogenic complications. So this is used when the systematic infection spread to involve the ear. For example, meningitis leading to labyrinthitis, systemic sepsis leading to ear canal infection, and also the skull-based osteomyelitis causing the ear complications. So these are the ear problems caused by the infections originating elsewhere. So in the same process, H94.8 for other diseases in the other disorders in the diseases elsewhere. So this is used for any other secondary ear disorder which is not covered in H94.0. For example, autoimmune inner disease secondary to the SLE. So neuropathy is related to the metabolic disorders. So the next subcode is H94.9, which is assigned for unspecified secondary disorder. So this H94.9 code, it is used when there is a documented systemic illness, ear symptoms are clearly secondary, but the exact nature of the ear involvement is not specified. So next is H95, which is the last code in the disease of ear and mastoid process. So this H95 is used for the post-procedural disorders of the ear. So these are the complications that can arise following ear surgeries or the procedures. So these codes, they are a part of medical classification system which are used for billing and tracking health conditions. So H95.0 is assigned for post-procedural hemorrhage of ear. So this refers to bleeding after ear surgery like myringotomy or mastoidectomy. So what do you mean by myringotomy? So this is a surgical procedure involving a small incision in the eardrum. So you can clearly see a picture of this myringotomy over here. So there is a fluid draining into the ear canal, and then there is an incision into the tympanic membrane. Placement, how do you incise? Placement of a tube with forceps. So there is a PE tube, which is a temporary ear tube. So this is how the myringotomy is done. So the next is mastoidectomy. So this is a more complex surgical procedure that removes the diseased mastoid ear cells, which are located in the skull bone behind the ear. So this is typically performed to treat the mastoiditis or the cholesteatoma. So the next one is H95.1 for post-procedural otorrhea. So this indicates the discharge from the ear following the procedures, and H95.2 for post-procedural stenosis of the external auditory canal. So this is a narrowing of the ear canal after surgery, trauma and inflammation, and also the myringotomy. And H95.9 code category for post-procedural disorder of the ear unspecified. So this H95.9 code is used whenever any other post-surgical ear disorder is not specifically listed. So there is another surgical ear disorder, but it is not listed within the record. Then you have to assign the code H95.9. So this is the classification of the diseases under ear and mastoid process. So this is for today's session. I hope the session has helped you. So in the next session, you will be learning about one of the body systems anatomy and physiology. Thank you.